Hi guys, welcome back again to my channel. I'm Ryan. Again, I'm a nursing student, and this coming fall semester we are going to have our maternity nursing. So I don't know a lot about it, but I started reading and reviewing some stuff about the course, so that when fall semester comes, I should be at least somewhat prepared for actual lecture and exams, of course. So today, it's going to be maternity nursing, and we are going to talk about contraception. So basically, contraception is the strategy or devices that are used to reduce the chances of the female getting pregnant. Because either you're avoiding the sperm to, you know, interact with the egg cell so that it's not gonna be able to fertilize, right? So, all right, so the thing that I'm gonna discuss today, because again it's a lot of topic, is gonna be the natural family planning. So there's 8 of them. This is from ATI. So again, for nursing students, we use the ATI to actually review, because ATI somewhat serves as the standard, right? So if you're doing good in ATI, whether it's proctored exam or non-proctored, it means you're assessing yourself how prepared you are in taking the NCLEX. Because our end goal is making sure that we pass NCLEX. Because what's all this work, studying for how many years, passing all these courses if you're gonna fail the NCLEX. So our goal is to actually be licensed and become a nurse to practice. All right, so there's 8 of them. So I'm gonna focus on this number 3, which is the calendar rhythm, because it involves calculation. The other ones I'm just gonna probably go over fast. So for abstinence, again, it's basically avoiding having sex, right? So abstinence, you're being abstained. So this is the most effective, as long as the couple, the male and female, is going to adhere. If they're gonna be abstain from sex, then they need to do that. But some people, it might not be the most viable thing for them. But again, because if you're abstain, that's likely you're not gonna have contact. You're not gonna have potential STI, STDs. Yeah. So the second one would be coitus interruptus. So this one is another way also for. It would say in the book that monogamous, right? Because you're only having one sexual partner. So this one would be the best one. It's basically a withdrawal method. So but again, the disadvantage of this one is if you withdraw, there's still sperm leaking on the fluid somewhere in the discharge, right? So it's still possible that the female would get pregnant. So it has pros and cons for this one. And the thing that I'm going to talk about is the calendar rhythm method. So this involves calculation, because the female needs to at least keep track of her menstrual cycles, right? So the recommended time frame will be 6 months. So she's gonna record all the menstrual period time frame that she has for 6 months, and then she's gonna note the shortest menstrual cycle, and then the longest. Because again, the ovulation of female was mentioned to happen 14 days prior to next menstrual cycle. I'm not sure if you guys can see that, but again, it's 14 days prior to the next menstrual cycle is when the female is most likely to get pregnant or conceive. All right, so once the female tracks the menstrual cycle, so she's gonna know the shortest one and longest one. So example, for the shortest one, it's whatever month. So every month has 30 days, right? So example, the shortest cycle would be start at the 23. All right, so whatever shortest days of cycle she has, she's gonna deduct 18 days on that. So 23 minus 18 would be gonna be 5 on the 5th day. All right, that's gonna be the beginning of the fertile period. And then the longest menstrual cycle example would be 27. She's gonna deduct 11 days on that, equals to 16 days, right? So 27 minus 11 is equals to 16. So that's gonna be, so for her to avoid getting pregnant based on the calendar rhythm method, the couple need to avoid having, you know, intercourse between like the 5th day to the 16th day of the menstrual cycle. So this is the computation that you have to learn. Again, you have to be, you know, adhere this one or be aware of this dates or time frame. So aside from that, we're going to the next one. Again, I'm just gonna go fast on this one. So standard days, again, based on our textbook or the book, ATI book, it's basically the same as calendar rhythm method, but they actually had the patient or the person like have beads on it with different colors like red, brown, so that they can actually, like, you know, because some people are visual, so they, once they see that, okay, so this is like the, you know, she was gonna be aware like, hey, this day, you know, we're not gonna do it because, you know, it's likely that she's gonna get pregnant. So this is gonna be for the standard days. Basal body temp. So this one is basically based on the female's temperature, right? So basically, you want the female to check her temperature right after waking up and before she gets out of bed. So that's gonna be the basal body temperature. So, and then this one, cervical mucus ovulation. So it was stated that you know, the female, if her discharge is like sticky, because again, based on it has like a factor on the ovulation also. So if it's sticky, and then it usually lasts 3 to 4 days, and that's if, you know, if that's is like the case, she's most likely to get pregnant. So she needs to like track that, so that, you know, if it's not sticky enough, you know, then she's not susceptible to becoming pregnant. The 2-day method. So again, this is also based on the calendar, not calendar. So the requirements for this one is like the female has to have like 2 days straight, like with discharge of you know, the mucus discharge, and if not, you know, she's actually good. She's not gonna have like she's not gonna be on the fertilization period. And then the last one would be the lactation amenorrhea method. So this one is, when I read this one, it was saying that it only is applicable if the female has an infant of less than within 6 months or less, you know, and then she needs to like work with breastfeeding to actually like control the ovulation and fertilization, right? So I forgot the requirement, but it's supposed to be like at least every 4 hours, and then 6 hours during bedtime. So yeah, so I think it's a lot of information for me. Like, this is like a new information for me as well. But again, thank you guys for watching. If I mess it up, if I'm missing something, you can probably comment down below so that I'll be aware of what's going on. Alright guys, thank you guys for watching.